Welcome back to the Thom Hartmann Program. I'm Alex Lawson, filling in for Tom, and real pleasure to be joined in studio by Will Fischer, the Director of Government Relations with VoteVets, the largest progressive veterans organization in the country. And we were just at the anti-Trumpcare rally last week.
We were.
And I want you to tell everybody about the attack on veterans that is also part of Trumpcare. But were you there to the end, to when we were chanting shame at them?
Yes.
That was a really powerful moment, I felt. There was a line of protesters who'd been there for hours already, and then chanted shame for, I don't know, 45 minutes. There was also a woman with a bell behind me. And so, I mean, it was a very powerful moment because it just kept going for 45 minutes. And these members were walking down to get on a bus, and they were going to the beer bash at the White House.
We're going to go celebrate taking a healthcare tax credit from 7 million veterans.
Yeah, for attacking 7 million veterans. And I think some of them were a little jocular in the beginning, because we were shame. And they were giving us thumbs up and things like that. But then after 45 minutes of it, and the chant changed also to 2018.
Yeah.
And I think that's when you started seeing a little bit of a difference from some of these members, that it started dawning on them what they'd just done.
And the ads that they just now helped create.
Man, they wrote them themselves.
Rolling in beers to celebrate taking healthcare away from people.
So tell us about, so I already have the attack ad in mind. I watched it write itself. It's called The Deciding Vote, right? Because they pass it by one. So literally every single one of them cast the deciding vote that attacks 7 million veterans and their health care. So tell us about that.
Absolutely. So the way Trumpcare is written, right now under ACA, people are afforded tax credits to purchase health care on the exchange. The way Trumpcare is written, though, it says if one is eligible for a different type of government health care, they no longer are eligible for those tax credits. So if someone is eligible for the VA, they may not be, they will no longer be able to receive this tax credit. The reason that is such an issue is there is a huge difference in all things, but certainly with the VA, the difference between being eligible for something and being qualified for something. I'm eligible upon turning 16 years old to have a driver's license. If I don't pass the test, I'm not qualified. So with something like the VA, we have tier system where someone who is a tier 1 is going to be someone who's 100% disability, automatically qualified for the VA. This goes all the way down to tier 8. And a tier 8 would be someone who has no service-connected disability and makes over a certain amount of money. So they're eligible for the VA because they're a veteran, but they're not qualified. So they're never actually going to be able to get in there to be seen. Now, I would add that Donald Trump's federal hiring freeze, coupled with the fact that, according to Donald Trump's own VA Secretary David Shulkin, there are 45,000 vacancies at the VA. That's certainly not helping to quell this issue. So that number of veterans who are not enrolled in the VA, whether because they are a tier 7, tier 8 not qualified, because they are already receiving, an employer-based healthcare system, so they've just never even enrolled, or maybe they just live out in a very rural area, 9-10 hours away from a VA facility, is estimated to be between 7 and 8 million veterans. And Donald Trump and the Republican Party just now took the ability to go out and purchase health care on the exchange through a tax credit away from those veterans and imposed a tax on veterans to be able to have access to our health care. Now, you brought up 2018. I wanted to be as crystal clear to any member of Congress who voted the other day, and I said this when we were together last week. Your constituents are going to know how you took this, how you voted on this issue. And if you voted to take tax credits away from veterans, we are going to run ads. We are going to knock doors. We are going to send direct mail. and you will not be able to go anywhere, not to church, not to a community event, not to the supermarket, without your constituents pointing at you and saying, hey, look, there's the member of Congress who thought it was a good idea to punish veterans with Trumpcare. Now, maybe some people aren't going to be worried about that. Maybe that isn't as appealing to someone as, going down to Mar-a-Lago and knocking back drinks with that, hyena in the White House. But there will be a price to pay. And people are not only going to know how you voted on this bill, but as the Senate continues to take this up, we're going to be continuing to mobilize to make sure that senators know about this issue as well and defeat this bill in the Senate.
And from my point of view, at Social Security Works, we're like, you just voted to raid Medicare and destroy Medicaid, the largest provider of long-term care in this country. 70% of the long-term care provided by Medicaid. Destroy it. $880 billion cut out of it. And there's so many who are going to be like, yes, your deciding vote, your vote made the decision. Raid Medicare, destroy Medicaid, raid Medicare, destroy Medicaid, attack veterans. I mean, I don't understand how they could actually think this is going to play. And I've posed this. I was talking with Wendell Potter earlier and the staff at Social Security Works earlier than that. I fought for Obamacare. I'm a single-payer person, but I came out of working in outreach clinics, and I knew that even a moderate step forward was a life-and-death situation for millions of people. Yes. And so I am proud of the step forward that Obamacare is, especially the expansion of Medicaid. The expansion of Medicaid is just an amazing good. And, I know I fought hard. There were late nights, hard work. It was super stressful and very difficult to do. And when I dug deep, I actually could picture my clients at the clinics that I worked at. And I could picture them and their names and clients that I've lost and their families. And I could say, this is who I'm fighting for. Right? I could see it. This is the fact that this human had to, say, oh, well, I guess I'm not worthy of health care. I'm not cost effective. Right? That whole concept was malignant to me. And so when I dug deep, it was in a faith-driven belief that my work was for good.
Yeah. I mean, Alex,
how do they do it?
Well, I think you need to go back and think of just two words you just now used when talking about this. This was a life or death vote. This was a life or death piece of legislation. And if Trumpcare does pass the Senate, if Trumpcare is signed into law by the President of the United States, people are going to die as a result of that.
Right. That's the thing that I did. I'm not asking you. I don't think you can deliver it to me. But when the people fighting for this dig deep, how do they do that? I knew it was life or death, and I was fighting on the side of life.
Absolutely. And Alex, I think that first off, no one who voted for Trumpcare should ever be able to call themselves pro-life again. But also, it's important to remember that this is just another chapter in a long volume of attacks on veterans and attacks on the working class being driven by Donald Trump and his allies on Capitol Hill. These are people who, you talk about veterans and healthcare. These are the exact same people who also want to destroy and privatize the VA, despite the fact that the Rand Corporation has said that the VA provides equal or better health care than the private sector across the board, despite the fact that veterans overwhelmingly oppose the idea of our VA health care being destroyed and privatized, and despite the fact that time and time and time again, the VA is a leader in not only R&D, but it's also a leader in providing world-class integrated health care. It's a leader in through things like the GI Bill, getting training and education opportunities to veterans and military families. It is a leader in people being able to purchase homes. And it's also the largest caretaker of veterans who have died in this country as well. So this is a system that is under attack. And again, these are the same people who attack veterans every step of the way. I just mentioned the GI Bill. Look, they're floating an idea right now to start charging privates when they first come in the military $100 per month to be able to use their GI Bill someday.
So, Will, in the last minute here, I want to. Yeah. This is what I say. The billionaires on Wall Street, they profit off of destruction, chaos, misery, inefficiency. Therefore, they see systems that work, and they have to destroy them. Social Security works. Medicare works. The VA works. And that's why they are driven, because they know that chaos is where their profits come from.
Absolutely. And it is about profits. Look, people want to destroy and privatize the VA, the people who do want to do that, because, look, absolutely, there's a tremendous amount of money to be made in off of providing care for veterans. But a more sort of surreptitious reason is rooted in ideology. The VA works. The VA is popular among the people who use it. And the VA is also a government-run single-provider healthcare system. And people know that if they can destroy the VA, which 9 million people are very poll after poll shows happy with, they know they can dash the hopes of universal healthcare ever being realized in this country.
And that is what it's all about. It's not just attacking the VA, it's attacking the concept that we can do these great things when we work together. Will Fischer from VoteVets, thanks so much for joining us on the Thom Hartmann Program.
Thank you so much, Alex.